What can I expect when I get a lumbar puncture?
Hello, I'm Dr. McElveen. Dr. Ralph Gonzalez and I are performing research studies at the Bradenton Research Center to try to find better treatments for neurological conditions including Alzheimer's, Parkinson's, and multiple sclerosis. In my neurology practice, I frequently have to tell patients that we are limited with our diagnostic abilities and certainly with the medications that we have to use. Through research, we are hoping to improve our care for these patients. We are presently doing a study looking at spinal fluid markers in patients with these conditions. I've performed hundreds of these over the years, and it's really a rather simple procedure. If you look at the model that I have of the back, when one feels their backbone, what they're actually feeling are these spinous processes. The area where we take the spinal fluid is a good bit more forward. People are often worried that they're going to be paralyzed or somebody's going to hit their spinal cord. Well, that's not going to happen because the spinal cord actually ends up at this area, which is the T12L1 interspace. And what we do is we feel the hip bones, which are about the L3-4 interspace. We then come across, feel these spinous processes, and that's where we do the procedure. We clean the back off with a cleansing solution. We then put a local anesthetic in the area to numb the skin. And at that point, we just slip a needle in between these two spinous processes into the area that contains spinal fluid. We do the procedure in the sitting position. After we get fluid, we then let it drip out into collecting tubes. The entire procedure, as far as the spinal tap itself, takes less than 5 minutes. The fluid collection takes probably another 20 or 25 minutes because we're taking about 2 tablespoons of spinal fluid. The amount of spinal fluid we take out at one time is not really missed because the body makes about a pound of spinal fluid a day. The main complication that patients get with this is that of headache, and it occurs maybe in 5 or 10% of patients. So to prevent that, we have the patient lie down here at the center for about an hour, and then we ask them to lie down at home for about 3 hours. That takes the pressure off of the spinal fluid, allowing the spinal canal to heal. After we take the spinal fluid out, it is shipped to a laboratory where they do evaluations for various clinical markers. The patient is paid a stipend for the procedure. It's done about every 6 months and is, of course, voluntary. If you would be interested in participating, we would appreciate your assistance. Just call Bradenton Research Center to set up an appointment.
A look at the lumbar puncture from the patient's point of view.
So why did you want to be a part of this study?
Well, I believe in research. I think it's very important. I have MS. I've had it for a long time. And if I can contribute to research that might help other people, I'm happy to do it.
And how long have you been doing it for?
I've been doing it for 3.5 years.
And you've come back every 6 months?
Yes, every 6 months, and no problems at all.
Have you ever had any side effects from the procedure?
No, I haven't. I've had no problems at all, and it's very easy to do.
Great. We really enjoy having you. We thank you for being in research.
I'm thrilled to have been asked. Thank you.
Day of the procedure.
This is the position that the patient is in while the fluids are being collected. Are you comfortable?
I am.
It only takes about 20 minutes for the collection of the fluid. And after that, it's all finished. Vitals are taken to make sure that everything is fine with the patient, and the procedure is over.
Prior to your departure, a study nurse will take your vitals and remind you to drink plenty of fluids throughout the day, as well as to rest at home for the next few hours.
Hi, my name is Cynthia Margolis, and I'm a volunteer for the study of Alzheimer's as other memory issue problems. Dr. McElveen has given me an LP so that my spinal fluid could be analyzed. I did not experience any problems with the procedure, and the care from the staff was marvelous. I was told if I experienced any problems to contact the staff at any time. I know research is our only answer to finding better treatments for this illness. So I hope you will consider helping as I did.
A lumbar puncture is one of the best ways we can gain new insight on how to treat diseases like Parkinson's, multiple sclerosis, and memory issues. If you are interested in seeing if you qualify for the lumbar puncture procedure, please contact Bradenton Research Center at 941-708-0005.